Hey, today we're going to talk about diabetes treatment success number 13, vitamin D. Now, you always seem to hear in the news that there's some new vitamin to consider or new deficiency to consider, but when it comes to diabetes or Hashimoto's or autoimmune disease, it's very important that patients are taking vitamin D to help their immune system. Modern diets are lacking in vitamin D-rich foods. What are vitamin D-rich foods? Liver. To be honest with you, I can't stand liver. Organ meats, lard, many forms of seafood, butter, and egg yolks. Remember what I said about eating eggs for breakfast and how important it is in your blood glucose level? Yeah, that's huge. Sunlight is another important factor and source of vitamin D, but you should never take vitamin D without having your vitamin D levels tested. Specifically, 25 OHD and 125 OHD. Most MDs will only test 25 OHD, but it's very important to have both levels tested. This way, you are eliminating the guesswork. You could be low in vitamin D or on the low side of normal. Either finding would constitute a different recommended dosage. Why is vitamin D so important? Well, vitamin D deficiency is associated with many autoimmune conditions. Frankly, autoimmune rates have been skyrocketing in the past 20 years, which correlates with decreased levels of vitamin D in the general population. Adequate vitamin D levels help to keep the immune system in balance so it doesn't swing out of control into an autoimmune disease. When it comes to Hashimoto's thyroiditis, the problems with vitamin D deficiency are made worse by genetics. There are studies that show that more than 90% of the people with an autoimmune thyroid have a genetic defect affecting their ability to process vitamin D. Therefore, many people, especially these kinds of people, need higher amounts of vitamin D to maintain health, even if their blood test shows sufficient vitamin D. In many cases, patients will come into my office and their vitamin D levels will be on the low side of normal, and their MD has told them, hey, you're fine. Okay, there's nothing wrong with you. When actually, if you're on the low side of vitamin D, you need to be supplementing. I recommend that all my patients with any thyroid condition or diabetes or any autoimmune condition take extra vitamin D. We look forward to seeing you on the next Success Secret.